All right, it's 1 o'clock. We're back. Thank you again for joining us today. Just a little housekeeping. If you could please type in your box yes if you can hear us and see the agenda up on your screen.
Thank you very much, everybody.
Awesome. Thank you. Thank you. So before we begin, I'm just going to go around the table here at the Coalition to let you know what staff are here. I'm Scott Stevenson. I'm the Quality Initiatives Director.
Elizabeth Viola, the Chief Program Officer. Marcel Easter, Business Information Director.
Deanna Johnson, CFO. Latricia Sims, COO.
Leanna Howard, your Professional Development Counselor.
Gary Brewster, Reimbursement Provider Relations.
Gary's not quite sure, but she's part of the team. That's all that matters. Yeah.
I'm scanning my card in the infant of the inclusion session.
Yay, congrats, Deanna, on your new role here at the Coalition.
That's awesome. And this is Roseanne Fricks. I have the pleasure of serving as CEO of the Coalition. And I'm going to start the meeting, if I may, gang, by sharing some really awesome news. And the rest of the team already knows it, so Deanna can relax. We are clearing the wait list. Yay. We have approximately 600-ish on the wait list, so that process will begin now. Historically, when we clear the wait list, we have about 50% of those on the wait list that are still in the area, eligible, have a need, purpose of care, et cetera, et cetera, et cetera. So if you begin to see your numbers increase, that is why. The way that happens is once families are contacted, they have a certain period of time. Latricia, how many days? 30 days to contact us for next steps, et cetera, et cetera, et cetera. So it's not, unfortunately, something that's going to happen tomorrow, but it is in the works, and we are moving forward with that. So I wanted to share that piece of good news with you, and I'll turn it over to Scott, Elizabeth, whoever.
All right. Thank you. So we're going to start off today's agenda a little bit differently. There's some programs here at the Coalition that some have been around for a while. Others are more new to us. But they're programs that you all don't hear as much about as you may hear about school readiness and VPK and first responders. So what we're going to do is I'm going to allow the ELC staff who are more involved and responsible for those on a daily basis to give you a quick little mini presentation on what they do and the programs that they represent. So first on the agenda, the first program, this will be Success by Six, and this is going to be presented by Chrissy Vickers, and she's our Success by Six coordinator. So let's see if we can get Chrissy unmuted.
Chrissy, you are unmuted.
Hello, everyone. Can you hear me?
Yes.
Okay. All righty. So I just want to give you a little bit of information on what Success by Six is. So it's a nationwide parent education initiative, and it's designed to increase the parents' knowledge on how to enhance their children's development from birth to age 6. So the goal of this program is that children are ready to learn and succeed upon entering kindergarten and throughout their lifetime. And so under the Success by Six program, we have 5 programs that we have that does assist parents in the community. We have our parent education program, baby safe sleep program, car seat and booster seat safety program, along with our diaper assistance program and our born learning trail program. So I want to just give you a little bit real quickly on the parent education piece. So with our parent education programs, they are free. And with this program, it's there for parents to be able to come, and we give them support and give them a lot of knowledge and different things that they can use to enhance the skills that they already have so that they can help their children. And one of the things that we do, and I actually just want to go over a few of the topics that we cover, from attachment, safety, discipline, safe sleep, health, nutrition, transition and routines, effective communication with your child at any age, fitness and gross motor skill development, and also social and emotional skills and problem solving. So this is a 6-week parent education program. And right now, due to everything that's going on with this pandemic that we're in, we are looking to move these classes virtually. So be on the lookout for that, and we will get more information out regarding that. We also have, to give you a little bit more on the Safe Sleep program. This program is able to provide information and resources, including a free pack and play for a safe sleeping environment for children 1 year and younger. So we give a pack and play along with a packet of information on the do's and don'ts of safe sleep for your children. So and we do serve the community at a great capacity with our Safe Sleep program, including DCF and a lot of our other organizations like the Alpha Center for Women and so on with that. With our car seat program, it's been a while, it's been around for a while, and we have been able to give out car seats to numerous families and also organizations like the Ocala Police Department. And so we just recently were able to get a amazing grant called the Buckle Up for Life grant. And so this is a partnership between the Cincinnati Children's Hospital Medical Center and Toyota. And actually with that, with our part in it, we received the gift of safety partnership, and that's actually what we have is the gift of safety partnership. And they have given us 76 car seats, free car seats that we will be giving out in the community. You do have to schedule an appointment, the parent does, and we will have a one-on-one educational session with the parents on how to successfully install a car seat for their child. And that's a process that we have to go through, and then they leave with the free car seat. So it's a pretty amazing program. We actually have a list that has now started. I have about 4 or 5 parents that have called wanting to get car seats done. So we're super excited about that. And I'm trying to make sure I stay within my time. We have our diaper assistance program, which we have done. We've collected thousands and thousands of diapers, and we usually partner every year with the Publix, with all the public supermarkets. So this program is available for parents to receive diapers on an emergency basis. They can come once a month to get diapers from us. We have all sizes from newborn all the way up to your pull-ups, 4T, 5T. And so that is available for parents as well. We also have our Born Learning Trails. And the Born Learning Trail is actually super, super amazing. It's an interactive early learning trail designed for children to use with help of an adult. These trails consist of 10 signs that contain activities designed to promote parent-child interaction with early learning skills such as letter naming, rhyming, using words, identifying numbers, shapes, colors, all of that. So we currently have 11 locations in throughout Marion County, which is awesome. And it is on the screen for those who are looking at them, but some of them are Bellevue Sports Complex. Here at the ELC, we have one as well. The Marion County Public Library has it, Cohadjo Park, and it's in Reddick, Dunellen, as well at those libraries and out in the forest. We also have one at Jim Kirk Park that we installed in 2018. And then last year we installed a Born Learning Trail at the Liberty Community Park. So our new project that we're going to install for 2020 is going to be at Brick City Adventure Park. We've gotten the clearance from Marion County to go ahead and install there. So we're in the process of getting that off the ground. So the amazing thing about the Success by 6 program, we have so much to offer, and the magic word is everything is free. And so we hope that we will be able to continue to help families throughout the community. Thank you.
All right. Thank you very much, Chrissy. That's a lot of information, a lot of helpful things you got there. If anybody on the call, if you think you know of a parent who could benefit from that, please give us a call at the Coalition, ask for Chrissy, and we'd be happy to give you some more information and get you hooked up in that program. The next agenda item on our list is our Help Me Grow and JP Foundation programs. And leading up those programs is Tanya Cox, and she's our Help Me Grow Care Coordinator.
Tanya, you are unmuted, but you are on self-mute.
Well, Tanya's getting herself unmuted. I'm going to go ahead and talk about the JP Foundation really quickly. We have a partnership. This is Elizabeth, everybody, by the way. We have a partnership through the Help Me Grow Connecticut, basically, that's the National Help Me Grow Forum, that granted us an award to partner with WIC to better develop our relationships with our WIC program here in Marion County. Part of that grant, we were able to apply for another grant through the JP Foundation. And this grant is going to help us provide needed supplies for infants in Marion County. And we're going to go through our community partners, and you all are part of our community partners in DCF to provide things like cribs, car seats when we don't have any more left from Buckle Up for Life, baby formula, baby medication, diaper bags, bottles, you name it, pack and plays, anything that's for the safety and well-being of an infant. So look for more information to come for that. Our county was awarded $43,000 to support babies in our community. So look for more to come from that. And Tanya's going to tell you more about Help Me Grow.
Good afternoon. I'm Tanya Cox, the Help Me Grow Care Coordinator. I work with families with children ages birth to 8 years old with any behavior, developmental, and educational concerns. Our goal is to connect our families in the community with the services that they need for the children. Caregivers may contact me directly, or they can go to our website and complete a Help Me Grow application. Educators and pediatricians can also complete the Help Me Grow application for a child as well. Once an application is received, caregivers are called. I'll give them a call to complete the intake process. During this intake process, I will give referrals, resources. I'll offer those as needed to the families. Help Me Grow also offer the ASQ3, ASQ, the social emotional. We do a pediatric symptom checklist, and also the modified checklist for autism and toddlers, the MCHAT. We do that as well. So we are able to help you all with the screenings. We can do the screenings as well. Help Me Grow provides care coordination to each family to ensure that they were connected to the services that they were given. So what I'll do is after about 2 weeks after I've given them the resources and referrals, I will do a follow-up call. This call is to ensure that they were connected with the services provided. And if they were having any issues trying to connect, then I will step in and also try to ensure that they are connected with those services. Now, I've created parenting kits to give parents, because sometimes we do have long waiting lists for certain concerns that our parents have. So if the waiting list is long, I've created the parenting kits to give to the families, and they can work on these parenting kits until they're able to get into the services that they were provided. And some of the categories are behavior, potty training. I do get a lot of parents talking about potty training, having issues with potty training, the healthy habits, and also toothbrushing. So I have plenty of items in my office, and as I talk to families, I will then individualize packets or care packets to give to them for to work with the children at home. And as Elizabeth did mention, we do the new initiative is actually working with our local, the WIC office, working with them. I refer families to them, they refer families to me. So we're just collaborating together a little more. And under that, we already talked about the JP Foundation. So we'll be able to order items for babies, infants, and be able to help our families in the community by being able to give them those. And I would like to thank everyone that has continued to refer their families to Help Me Grow. Thank you, and I really appreciate that. And we're just working with the families and trying to ensure that all their needs are met. And I do look forward to having a great year. And that's it.
Thank you.
Awesome. Thank you, Tanya. Thank you very much. Again, if you need or would like more information on that, that's Tanya Cox. Just call us here at the Coalition. The next program we have on the agenda is our Read Aloud 15. And Jolynn Rathel, she's our Success by 6 Family Support Specialist and Read Aloud 15 Specialist, is going to tell you more about that.
Jolynn, you have been unmuted.
Jolynn, are you there? Hello, hello. Maybe she needs to unmute.
She just muted. Okay, you're unmuted again, Jolynn.
Well, we could have Anna talk about 3 T's.
Yeah, we'll go on. Maybe we're having technical difficulties.
Come back to you, Jolyn.
We'll come back. So next on the agenda is one of our newer programs. This is called the 3 Ts. And again, Sienna McFarland, she's our infant, toddler, and inclusion specialist, is going to tell you a little bit about that.
Hi, good afternoon, everyone. So I'm just presenting about 3 Ts campaign. It's tune in, talk more, and take turns. Here we want just parents, providers on a whole, just to spend some more time with their children. The tune in is just to stay focused. Talk more using a wide variety of words with children to build their vocabulary, and take in turn engaging children in conversation, listening to them, responding, just being there, in the moment. There is a 3T digital tool, and here is where we need the support of our providers to get our parents involved, to get our families involved. And it involves you going on and signing up. And what we need you to do, however, is there's a drop-down menu when you go in to sign up that it asks where you have heard about the 3 Ts, and we need you to select Marion County ELC. Right, it's on the screen. I think one of the most exciting parts about it is the resources for providers and resources for parents. For the providers, we have videos, articles, lesson plans. Each time I go on the site, I feel like I find so much more. I just found out that there's a teacher's toolkit, and it has science lessons and printable things that we can use with our kids. I also saw them on Facebook, and sometimes we have difficulties getting fathers to get involved, but on the Facebook page, there are many videos, fathers interacting with their children, and it gives a wide variety of ideas of what we can do, what fathers can do with their children. Before the week is through, we're going to be sending out a flyer with all the information that I've mentioned, those that I've omitted, and you can go on the website and just explore. Thank you.
Awesome. Thank you, Sienna. Thank you so much. Do we have Jolyn? Is Jolyn back with us?
Yes, Scott, can you hear me?
Yes, we can. There you are. Thank you again. And again, Jolyn's going to tell us about the Read Aloud 15 program.
Thank you, Scott. Well, good afternoon. Again, my name is Jolyn, and I have the awesome privilege to coordinate a Read Aloud 15 Minutes, a program here at the Coalition. And so Read Aloud 15 Minutes is a national literacy initiative with over 10,000 partners nationwide. And we have about 500 partners here in Marion County. And so what does it mean to be a partner? It's simple, just that you agree that literacy is important for a child's development. Now, how do you partner? Well, many of you are already partners, and thank you for that partnership. If you are not yet become a partner, contact the ELC. My contact information is on the bottom of that flyer, and I'll be able to be more than happy to reach out to you and add you to the national partner site, which is readaloud.org. Now, from there, you're going to have access to tons of printable flyers that you can hand out to your families, posters for your classrooms, bookmarkers, reading trackers, etc. There is so much on that website. Another benefit to being a partner is that we will give you a BOB, which stands for Bucket of Books. And so in that bucket, you'll receive 15 to 20 new high quality children's books to keep in your classroom. And as the books need replacing, the great thing is all you need to do is reach out to me, and I'll be more than happy to arrange to get you some more books. And in closing, just to give you kind of an idea who our partners are, we partner with the Marion County Public School System, local businesses, faith-based organizations, healthcare centers, physicians, restaurants, childcare centers, and the Marion County Public Library System, and so many more. So again, I'd like to encourage you, if you'd like to become a Read Aloud 15 partner, feel free to call me at the number listed on the flyer.
All right, JoLynn, thank you. Thank you for that.
Thank you. Thank you.
There's information on all of these programs on our website, and you can also refer people to Help Me Grow on the elc-marion.org website. So if you need more information, you can go there.
All right. Next on the agenda is our good friends and partners at DCF. Richard Forrester is going to give us some updates from DCF. Richard, are you there?
Bear with me 1 second. Richard, you are now unmuted.
Yep, I'm here. Scott, can you hear me?
Yes, sir. Thank you. Yep.
Good deal. All right. Thanks for inviting me back again. I appreciate it. Do have a couple of updates. We received a memorandum that was dated August 17th, and it has to do with a couple of licensing standards that were impacted due to the COVID. One of them is the planned activities. You know, in the handbook, the facility handbook, section 2.6C, it talks about limiting electronic media for children to a 2-hour maximum. Well, we know with schools starting back that a lot of the providers are allowing school-age children to come to daycare rather than school and then use their electronic media for virtual school. So because of that, we know that 2-hour maximum is not feasible. So we're allowing them to go ahead and we're overlooking that current standard right now. As long as we come in and the school age children are on the virtual school and they're doing educational, looking at educational material. That also applies to the Holmes handbook as well too, and also the school-aged standard. And if anybody has any questions, just email Scott or Elizabeth, and then they can let me know. The second one is a communicable disease, which is located in 6.1.2 of the facility and the school-age handbook, and section 7.23 of the Holmes handbook. And that talks about, you know, the reporting practices if there's a suspected outbreak occurring. When 2 or more children or child care personnel have an onset of similar signs or symptoms of a serious reportable disease. Well, because of the COVID virus, the department is now requiring that if there's just one confirmed positive case of COVID, that we're asking that providers do these 3 things: that they immediately notify their local health department, which I think most are doing it anyways, but they must also follow their recommendations. They must also immediately notify the other staff in the facility or the home, if it's a large home or large after-school program, and also notify the parents of the children that are enrolled there, that there's been a verified report. And then within 1 business day, you need to notify your local licensing counselor. And if there's any registered family homes on this call, they need to call Tallahassee and notify the program office up there. So those are the 2 main ones that are affected right now. Also, I kind of want to go through something else. This is more, we've been calling providers on this. It has to do with background screening. And what I should have done, I should have sent everyone's like a template that you can look at. But what we're finding is most providers, when they send a new applicant for background screening, when they get that profile back, the first thing they do is they look at whether or not the applicant is eligible or ineligible. If they're eligible, then they go ahead and hire them, and then they put the profile in their employee file, which is all good, and you're doing everything that you're supposed to do. But what we're finding is providers are not looking at the section that talks about where the department has reviewed the child welfare records to find out whether or not that applicant has verified a child abuse report. Now, that doesn't disqualify them, but what that should do, that should notify the provider or give them a red flag, say, wait, we better ask some more questions of this applicant, you know, and bring them into the office and say, hey, it looks like according to your background screening, you're clear, you don't have any criminal disqualifiers, but it appears you have a verified child abuse report. Do you want to talk to me about it? Or would you mind going down to the Department of Children and Families and getting a copy of the abuse report and let me look at it? Because we're not allowed to provide that information, it's confidential, and the provider cannot call DCF. Only the person that was part of the, that was verified for the abuse can request a copy of their own report. And all that's doing is to allow providers to make an informative decision to hire quality childcare staff in their facility. It doesn't, if you decide to overlook that section, you're still fine because that applicant is eligible. But this is just for us to let you know that, you know, they've had a verified report. It could have been a verified report from 20 years ago that really was something minor. Or it could be something from just a month ago where they left a child on a van at a different facility, or they were verified for inadequate supervision, or it could be physical abuse for slapping a child, or it could even be an in-home where they've got a verified report on their own family dynamics, possibly family violence, where they continue to let the father who's abusive into the home, which means they failed to protect their own children because they're allowing an abuser back and forth. So there's all kinds of different maltreatments that you would want to look at on the verified report and then make a more informed decision. So if anybody has any questions about that, you can all relay them to Elizabeth or Scott, and then they can relay them to me, and I can hopefully answer any questions you have.
All right, thank you very much, Richard. Good stuff. Yeah, everyone, you're welcome to send those emails to me, and I can relay those to Richard. So good things to keep your eyes on as you're looking at those background checks. And thank you again, Richard, for being on. We really appreciate you.
Yeah, you're more than welcome. I'm going to step off unless you still need me to stay on.
No, that's quite all right. Marcy says she does have just one question.
Yeah, go ahead.
The question is, how long does it take for them to get the letter or a copy from DCF if we send them? Where do we see this on the report?
You talk about, okay, you should talk about the background screening. You should get that back within 2 to 3 days. Now, what we're finding is that a lot of these vendors, fingerprint vendors, a lot of them are closed due to the COVID. So you have to look within a 50-mile radius of your facility or home, which may end up even being in a different county for them to go get their fingerprints done. But you should still be able to get them within 2 to 3 days at the max. And then so if they're looking at once they do get that back through the clearinghouse, probably in the middle of the profile page, there's a part that says Department of Children and Families eligibility, and it's got a little question mark next to it. And it states that the department has reviewed the child welfare records for the state of Florida. This search was conducted in the Florida Automated Child Welfare Information System, which the acronym is SACWIS, SACWIS. And underneath that, there's 2 sentences. One sentence says, there is no record of the applicant being listed as a caregiver responsible for a verified finding of abuse, abandonment, or neglect of a child. If that's got a check mark by it, you're good as gold. You're good to go. You don't have to ask any more questions. However, if the second sentence is check marked that says the individual may request additional information pursuant to statute 39.202 of the Florida statutes, that's a red flag that applicant has a verified abuse report. So hopefully that answers the question.
Well, they gave a little bit more clarification on it. We're asking about the letter if they're eligible and have a verified report. How long, if we send them to DCF for the letter, does it take them to get that letter?
To get the abuse report?
Yeah.
Well, it depends, because they're going to have to they're probably going to have to request it, and I guess it depends on their location or which county they got to request it from. Some of the ones I'm seeing, you know, they're requesting them locally. Like I just saw one today that they're requesting it locally. However, the abuse occurred 5 years ago down in Charlotte County. So, and they won't mail the applicant a copy of the report in the mail. They have to go down there, or they can even go to one of their local DCF offices and see if they will print off a copy. But they have to show proof, you know, that they are who they are by showing ID and possibly social security number. And it could take you know, 2 to 3 days a week, depending on what their, you know, backlog is.
Okay, that was it? All right, thanks again, Richard. We really appreciate you being on and answering these questions. And if there's more questions, I'll get to you.
Sounds good. Thanks, Scott.
Thank you. All right, next on the agenda is a small training that was put together on full-time school-age care. And Marcy Easter, our Business Information Director, is going to tell you more about that.
Okay, as we have announced, I believe on the last call, OEL has agreed or sent directive guidance down that the children who are school agers, whose parents have decided to keep them at your centers and not send them to our traditional brick and mortar schools, that you will be able to have their reimbursement back at full-time rate. What Elizabeth has included in her emails is a frequently asked question that should answer most of your questions in regards to this. Now, with this, you need to understand these children, you will be reimbursed at full-time rate, though the parents' copay will be at part-time rate. This is extremely important because this is how the system mod works, and this has to stay consistent throughout the state. So for those families coming to your site, no brick and mortar, full-time rate you will receive, but you will only collect the part-time rate from the parent.
Part-time copay.
Copay, thank you.
So just to remind you about copays, the coalition is continuing to pay copays through the month of August. Starting September 1st, you will need to be prepared to collect those copays from the parents again. And so when we're talking about the students that are full-time enrolled school-age students, just to summarize what Marcy just told you, if their parent has decided not to enroll them in their brick and mortar school, their elementary school, or in some cases middle school, depending on how old they are, and they're staying at your site full-time under the school readiness program, you will only charge them their part-time copay. So you can find the parent copay on the certificate for school readiness, and that's located in EFS mod. But remember, you have to get the parents to accept the terms and conditions in order to be able to view that certificate. There's a couple, I think, other places too you can see the parent copay, but that certificate is the easiest place to find it.
So how you're going to handle this in mod, because all the children have started school, or school has officially started, I should say, as of August 24th, is this little quick tip guide for you.
Where is that one?
They will be getting this. It's actually in the attachments here, so anybody who is online, you can download it from our attachments on this, as well as Scott or Elizabeth will send it out with your next update. So basically what you're going to do is when you select a child, you're going to click on the unit of care in the calendar, and you'll see it says click to change unit of care. When you click that, you will get this pop-up. The pop-up is confirming, yes, you want to change that unit of care. and you will click yes. You will receive another pop-up with the unit of care selection. You will click this caret to drop it down, and you will see all the different types of unit of care. These children are going to be marked as part-time as if they were attending school. What you'll need to do is select the ST, the very first one there, full-time greater than or equal to 6 hours and less than 11 hours. When you select that, you will then click Save. Steps 1 through 4 will need to be completed every day that child is eligible for full-time care. Starting in September, you will see on your child's information area on the side a schedule note that states child is eligible for full-time, not attending brick and mortar. Some sort of comment in regards to that our Family Service Department will be including in the enrollment notes based upon the list that you are providing the coalition with for the children who you have enrolled that will not be attending the brick and mortar school. This is how we will validate your changes of the unit of cares to those children that should have those changes completed. Now, I believe this request for the list of children that you already know that are not attending the brick and mortar schools has been requested by Elizabeth in your provider email. Go ahead.
Yes, you're in the email that you got from me yesterday, late last night actually. The first bullet in that update has the frequently asked questions in it, and then just a little memo from the coalition that kind of supports OEL's memo, as well as a request for you to upload a list of the children's names who you know would typically be attending school in a brick and mortar facility, who are actually their parent is choosing to keep them at your site and attend virtual school. So if you already have some of those, that will help us make sure that your payments are correct and that we can help support you through, because this is a little bit different than what you normally do. So again, we're just asking you to upload a list to BlueJean that of the children that are school agers that are remaining at your site full time during school days. Good. Yep. Do we have any questions?
Well, thank you. And everyone, keep in mind, if you want to go through this process again with Marcy, you can always access our YouTube account. So it'll be a few days before it's up, but if you need to refer back to this presentation, you can access it there on YouTube. All right, next on the agenda is VPK Flexible Innovation Options.
That's me. Okay, so long awaited. We have been asked quite a bit about options and opportunities for VPK providers to offer a flexible option for attendance in VPK. You have in front of you on the screen, and it was attached to the email that went out last night, there is the summary of the flexible options based on what we know right now. There's quite a bit to this particular option. I'm going to keep this very general and encourage you, if you're interested in offering a virtual potential, we're not supposed to call it virtual, but an innovative, flexible option for VPK. If you are interested in offering something different than your children attending in your classroom, then I would highly encourage you go to the email that I sent you last night and register for one of the webinars that OEL is offering. They're starting today at 3 o'clock. I will be on the webinar this afternoon at 3 o'clock so that I can hear what OEL is telling everybody. And then there is also 3 additional opportunities on Wednesday at 9 a.m. and then again on Thursday from 5 to 6 p.m. and on Friday from 1:30 to 2:30. And you can register for any of those. So after this afternoon's call, they will all be a repeat of the same call. I would highly encourage, if you have been one of those providers that says, I would like to offer a different opportunity for my kids that their parents do not feel safe with them returning to VPK, please join us there on one of these calls so that you can get all the details, because there are requirements you have to meet as a provider in order to be able to offer this innovative, flexible option for VPK. There was a wonderful memo put out by the ELC of Pinellas County that I pretty much copied and pasted that talks about exactly what the requirements are. So this went out to all of their providers as well. All I did was put it on our ELC information, our letterhead, so that you would contact us and not Pinellas County if you had a question about your VPK program here. I would encourage you to read through that. So we have a handful of providers that are interested in this option. Read through that document. Make sure you join us on one of these calls, and then we will have the opportunity to work with you one-on-one if you are a provider that chooses to do this. Please know there is a deadline for this opportunity, and it would, once you're qualified to offer this flexible, innovative option, you will have until December 31st to carry it out. And then everything will, as it has been since March, we continue to look at these things on almost a weekly, daily, sometimes minute-by-minute basis, but we will keep you informed as things change and as we know more about this piece. And while I have the floor,
Can I ask a question?
Roseanne raised her hand. I know you can't see that, but she raised her hand.
So Elizabeth, talk to me about the hours in the VPK Flex program through December 31st.
So
540.
it is not.
70.
It is not. So in order to offer this flexible option, you can only offer half of your program through this manner. So it would be a maximum of, instead of 540, 220 hours, 270 hours. What Roseanne said. This is why I'm not finance. I'm programs. Keep me in programs, guys. So there's a lot of different things, and that's why I encourage you, read through that line by line. There is going to be more information coming out. We are moving through this really fast because the recognition of the time constraint is there. You do have to offer at least one face-to-face classroom opportunity meaning you have to have one classroom open for face-to-face enrollment. Then there would be the opportunity, if you qualify, there's a big caveat, if you qualify, where you can open up another calendar for this option for 270 hours. So that's a lot to digest. We do not have all the answers. I'm going to tell you that right now. We're reading through this and we're trying to keep up at the same pace as all these changes and support you through it. I do want to pause for a second and see if we have questions that we might be able to answer.
I think we may need a little bit more information. It says, what if the parents work during the night and home during the day? How would that work with the virtual school?
If the parents work during the night and they're home during the day, I think we do need a little more information on that, because I think you're referring to the full-time. Is that what you're referring to, is the full-time reimbursement for school agers? If you are, it would just depend on the time frame that the child has to attend your program. If they're not attending during school hours, it may be a non-issue for you and you get reimbursed based on the child's eligibility for reimbursement.
Normal.
Yeah, it would be their normal eligibility, just like you probably have in the past. If that parent has always been a third shift worker, you have probably provided a lot of flexible opportunity for that family, but it would be probably along the same lines.
The next, providers on probation, are they not going to qualify for the flex learning?
So there are numerous assurances with this. I can read through them, or you can read them for yourself on the second page of this document. You have to provide equal access to learning and the required materials, including technology. The delivery of the program has to be done by qualified staff, including daily contact with enrolled students and their families. The Flex program will not exceed a total of 270 hours prior to December 31st. The provider must allow students attending the Flexible Innovation Program in the fall 2020 to return to face-to-face delivery model after December 31st. And for the remainder of the school year, you have to track daily attendance of both the students and the staff, monitoring of the student performance using the VPK assessment. You have to give a reminder to the parents of the opportunity to withdraw and transfer to another program if they choose. And you have to ensure that the systems are secure. There has to be access to your program by ELC and OEL staff. And then actually, that was the assurances. And if I go back to answer your question, your program, if you offer the Flex, must align with the school district's approved reopening plan. In the email that I sent you yesterday, last night, has a link to the district's reopening plan, which is 75 pages long, which is why I did not attach it to your email. Underneath there is also Florida's optional innovative reopening plan. That's Marion County's. It's much smaller, it's easier to digest, less pages, and it's got some more information on the actual plan that we are using. I have not answered your question yet. So let me go back. I'm giving you, that's why I said I wanted to keep this pretty broad, but it also seems necessary, especially since this is being recorded, so you can go back and listen to my droning voice on again over and over about this. The requirements for provider eligibility actually start on the first page of that document that we released. Proposed flexible program must align with the school district's reopening plan, like I mentioned before. The provider must be open and offering an in-person VPK class in order to leverage the innovative option for families who choose it. So you have to offer face-to-face class as well as this. Private providers must be in good standing with the statewide VPK provider contract and have no Class 1 violations within the last 2 years. So that one is going to be the one that you really want to look at. So let me read that one more time. Private providers must be in good standing with the statewide VPK contract and have no Class 1 violations within the last 2 years. The next bullet there says submission, certification, and approval of required program assurances must be completed via EFS mod for private providers or via OEL for public providers. And then the provider must identify VPK Flex classes via EFS mod. So to answer your question about being a provider in probation, as long as you have submitted your improvement plan and it has been approved, you are in good standing with your contract. So that would not prohibit you from offering this option.
I have a couple of questions. Are there any VPK openings in centers and schools, and are you enrolling any more children in VPK?
So the answer to that is a resounding yes, yes, yes. There are lots and lots and lots of openings. We are continuing to enroll in VPK all over this county, and I imagine that is the same throughout the state of Florida, with parents being fearful of sending their children back to a brick and mortar school, whether it be a preschool VPK program or a public school. There are openings all over, and we encourage you to get out your creative hats and advertise your programs. Help us. We have some billboards going up in certain parts of the county. We are spreading the word through social media, and we encourage you to do the same to get more enrollments. And if you're holding COEs, we encourage you to submit those. Scott's going to talk about that in a few minutes here.
One more question.
Okay.
Is this Flex an option if we have to temporarily close due to COVID?
So it goes back to you have to be offering the second bullet on the first page of this. The provider must be open offering in-person VPK. So the answer to that is no. You have to be open offering in-person VPK.
Will VPK be paid based on enrollment, or will it be based on attendance?
Okay, so the question was, will VPK be based on enrollment or based on attendance? At this time, all enrollment for school readiness and VPK is being based on enrollment through the month of August. We do not have any further directives at this time as to whether that will remain for the month of September or beyond. So right now, you can plan that you will be paid for your enrollment through August 31st. Nothing past that is guaranteed, and as soon as we find out more information, if that changes, we'll definitely let you know as soon as we know. Any other questions? I'm going to take this second while Scott gets ready to take the next part of it. I just want to go over a couple of things that are not on your agenda, but were in the email last night that I want to kind of highlight. The follow-up information from Richard Forrester from our last VPK meeting, or not VPK, now VPK is on my mind, our last provider webinar on August 11th. The follow-up information for clarification on safety plans is in that email from last night. Then the other pieces you have are some pretty, I think they're pretty cool COVID-19 resources. CDC issued another update on August 21st for schools and childcare programs. I would highly encourage you to check that out. In your email, it is a link directly to that update, so feel free to click that. The other thing that was just released this week, United Way of Marion County is offering a coronavirus relief fund for families. There is a link in your email from last night as well where you can share it with the families, post it to social media. The United Way of Marion County's Facebook page has it on there. It's on their website. Please share that information and just help spread the word, because it's been a little while since there's been some financial relief opportunities for families. We started out with a few back in March and April, and now people are trying to get back to work, and this is a really, really good timing for an additional set of supports that's out there. The other piece that's in there is FLACY has a training bundle. I've had a lot of discussions with providers, and I learned something new today from Richard from DCF about letting families know when you have a positive case. So that was new for me. And there's lots of different resources out there to help you create your emergency plan. One of the biggest things that I say to providers is whatever you choose to do as your response to this, I mean, outside of what we have to do, of course, but things that are your business decisions, you want to make sure that you do that over and over again. You are consistent with your response. So you put it in your COOP plan, your emergency plan. If you get a positive case and you are closing your site down, then every time you get a positive case, you are closing your site down. And you want to let parents know that in writing, even best practice, get it signed off on them so that they know what to expect. And that way they're in the know to make a educated decision about their child and their child care needs too, based on what your plan is. They have a good expectation of what you're going to do. So FLACY is offering a training bundle. It's $95. The coalition still has professional development reimbursement opportunities for teachers. We encourage you, take advantage of these things. They are here to help support you. And hopefully those bundles, that's for preparedness, and it's coronavirus training. I can't tell you what it consists of, but I can tell you it got my attention when I was just doing a little bit of research. There's also a hashtag COVID Stops With Me toolkit. And there's a website, there's a link in the email for you to check that out. It's a toolkit, and again, this all comes down to awareness. We all know to wear our face masks when we're out in public or when we're in a room with lots of people. We know to wash our hands and sanitize surfaces and continue to use hand sanitizer and protect our children and the vulnerable populations. And this is just a really cute way of keeping this in the forefront, because sometimes we still forget that there's a pandemic going on in the hustle and bustle of everything else that's going on. And last but not least, in this particular set of resources, Dr. Pam Phelps, who a lot of you may know, she is a mentor of mine and is well respected in the field of early learning. She did a forum and a little webinar series, and we gave a link to you. She has a lot of really practical tips Roseanne was bragging about her this morning when we were in our meeting, talking about, man, these are really easy ways to protect your kids, and they're smart, and they're just easy, they're cheap, because if anybody knows Dr. Phelps, she does not like to spend her money. She wants to be creative and use things that she has on hand to make the early education experience excellent for children and families. So we encourage you to check those out. And of course, let me stop and see if we have any questions before we move forward.
We do, not in regards to that.
Okay.
I'm going to put two of them together because I believe it's going to answer both of them. When do we start collecting parent fees?
September 1st. Okay, say it with me, everybody. Ready? September 1st. Collect your parent co-pays.
On the first responders, what date does their care end?
So you want to look at the referral. You want to look at those eligibility dates on their referral. And I'm looking at Latricia. She's nodding her head. Do you want to add anything to that?
Now, as of right now, you would watch the child care authorization end date. We have been sending out new referrals a month in advance. So if you have any questions on any families that may or may not continue to be eligible, please contact me and we'll be able to answer your questions.
Any other questions?
No.
All right.
All right. Next, I'm just going to go quickly over some VPK reminders since we just finished renewing the VPK contracts. So if you, well, first of all, we just wanted to remind folks that you only have to have 4 enrollments in order for you to start your fall program. As we did some calls a few weeks back, we discovered that some folks thought that you had to have 4 attending, and that is just not the case. So, for example, if you have 4 enrollments and only 2 children attending, you can still start. You can still have your official start date, and we encourage you to do that. So if you happen to be holding on to COEs because of this, please get them submitted. Submit your COEs ASAP as quickly as you can. Number 2, if you're trying to change your start date for your VPK program and you're having problems doing that, if you would, please send those to us because some providers we're finding are having difficulties doing this while others are not. So if you're one of those providers who is having trouble in the portal or your VPK application changing your start date, if you could send an email to quality@elc-marion.org and kind of be as detailed as you possibly can, because these might be ones that we have to send up to OEL for a resolution. And the only other real reminder that I've got is for your VPK assessments, we just encourage you to get those done as soon as possible. The deadline to do your VPK assessment is 30 days from your start date. And you have 45 days from your start date to get them in the Bright Beginning system. So again, for example, if you opened up your doors and your first day of school was August 10th, you have until September 10th to get your assessments completed and September 25th to get them into Bright Beginnings. Anybody want to add anything?
Just submit your COEs, and we do have a bunch of assessment kit orders in process right now. So we received a ton of them over the last 48 hours. So please bear with us. I am approving those as I'm able. I will get everybody who has requested new assessment kits on Bright Beginnings. You'll be processed this afternoon. So you'll start to get those kits in. Can we just keep going? Because
go for it.
A couple minutes. Yep.
Yes, yes.
One more thing on VPK. We still have a lot of VPK verification forms that are still outstanding. And just a reminder that we cannot release your final payment from last year until we get those forms back. So if you have not yet logged into Blue Jeans and pulled down your VPK verification form, I encourage you to do so.
I want to pay you.
Yeah, I would like to get this paid as soon as possible. If you are unsure, just check your Blue Jean account and you'll see this. They were all uploaded on July 2nd. We will be uploading some more this week for those that had some reclaims for the end of the fiscal year that we did with the July attendance, and we will get those uploaded by Friday. So please get those submitted so we can get those payments released to you. Thank you.
All right, and we are going to wrap up the call just with a little reminder that we are going to be sending out our 1920 contract, school readiness contract amendments. Over the year last year, some of you, and it's not very many, but some of you made some changes throughout the year to your profile that would typically require a contract amendment. And at that time, we made the decision to hold off and see if EFS would catch up with the ability to process those contract amendments through the system rather than on paper. It did not. So we're going to go back before we initiate your 2021 contracts and make sure that all of that information is neat, tidy, and cleaned up. So if you get a contract amendment from us from last year, this is just a heads up as to why you're getting that. It's just simply to clean up the information to make sure that we're capturing what's actually happening in your classroom based on your profile. And then the last thing, we did get a request for a potential time change to this meeting due to bus run schedules. If this is a concern for you, remember this is a recorded meeting. I would encourage you to submit a suggestion in the chat box. If you have a better time that you would like this meeting to occur, just submit it to the chat box because we do review that and we keep a recording of that. So if you have a suggestion for a time change, let us know. And Marcy has questions, maybe?
One last thing. I know Elizabeth just said that. Roseanne asked for me to launch a poll for you. So on your screen, there's a poll. If you could take a few moments to go ahead and answer that, throw the suggestions on the different times up in the chat question box.
And this is a poll. This is the first time we've had multiple speakers from different areas. We've always, like, DCF logs in remotely, and so we have some opportunities from time to time. So we want to see if this was an easy way for you to understand what everybody was saying.
And while you guys are answering the poll, also just to let you guys know, if you received a payment today, that payment was for your 2019-2020 school readiness registration fees.
The first round.
The first round. And there will be more coming for those that have not yet been processed. And those will come out next month. And then also tomorrow, for those of you who have essential personnel, those bonuses will be paid out and will be in your bank account tomorrow morning.
Yay, we love good news. And with that, we're going to close out with this. And again, please let us know if you need anything. We are always working with you. Bye, everybody.